Hello, I'm Dr. Heiner. I've prepared this brief video clip to talk a little bit about the urinary difficulties that men experience, often because of their prostate gland. I want to show you the prostate here. The prostate sits right here at the base of the bladder. The bladder is where we store our urine, and when the bladder fills up and squeezes, it pushes the urine through the prostate gland here, through the penis, out to the outside world. The prostate, as we age, continues to grow. It gets bigger and bigger, and that passageway we urinate through gets smaller and smaller. So most of us notice that our stream weakens quite a bit as the years go by. In fact, some men, the prostate will get so tight, they'll end up in the emergency room unable to urinate and have to have a catheter put in. Some men will get bladder infections because they have a lot of stagnant urine left over in their bladder that they're not getting out. Some men will be up and down a lot at night to urinate. If your bladder fills up and then you go to push all the urine out, but you don't get it all out, it doesn't take that much longer for it to fill up again. Most of us notice that as the years go by, our stream has gotten weaker and weaker, and it takes us longer to empty our bladder. For many of us, it doesn't affect our quality of life, but for some of us, it really can affect our quality of life, and in fact, affect our health. I mentioned that you could get infections or end up in urinary retention. Some people will also end up in kidney failure, and if the urine backs up all the way to the levels of the kidneys, it can be really detrimental to your health. But for most of us, it's a quality of life issue. How frequently we have to urinate, if we're having to strain to void or push, if we're having urinary frequency or urgency, those can all be signs of an obstructive prostate gland. The evaluation of this condition includes having a rectal exam where we put our finger in the rectum right behind the prostate and can feel the back surface of the prostate to make sure we don't feel any lumps, which could represent a cancer. And also checking a PSA or prostate blood test. That's also to screen for cancer. We have you fill out a questionnaire that talks about your urinary symptoms and tells us what they are and how much they're affecting your quality of life. We also, at that point, often will try a medication that relaxes the prostate or shrinks the prostate in the hopes that it will help men pee better. Often it does. When it does, then we assume that it was the prostate, and we tried you on the prostate medicine, and you're doing better, and some people are happy with that. The next step of evaluation is a procedure called cystoscopy, which involves a tiny catheter camera that we pass through the tip of the penis, into the prostate, and into the bladder, and we can assess the urinary tract to see exactly what the problem is with the obstruction. Sometimes it's not a prostate problem. Sometimes it could be some scar tissue somewhere else in the urinary tract. Sometimes the prostate could be open, but the bladder is weaker and it's lost its ability to squeeze. So part of that office procedure, cystoscopy, that we do in the office, it helps evaluate with that. That's not a procedure that requires any anesthetic. It's not painful. It's a little uncomfortable, but it's not something that we have to medicate people for or that people should worry about. After a cystoscopy, the vast majority of people say that that wasn't as bad as they were afraid it was going to be. For some people who have diabetes or have had a stroke or other neurologic symptoms, there's another test called urodynamics, which is a little more involved and tells us a little bit more about the bladder function. But for most patients, that's not a requirement. So that's kind of the evaluation aspect. The treatment aspect could range from doing nothing, which is benign non-intervention. So some men will say, well, I'm having some urinary symptoms and I'm getting up once or twice at night, but that doesn't bother me enough to want to take a medicine or have a procedure done. And so that's an option. Most men will start on some type of medical therapy, which involves two kinds of medicines. A kind of medicine that relaxes the prostate and can make it easier to get the urine out. Those can actually take effect within a week or two. Some people will already notice improved urinary stream. Another class of medicines actually shrinks the prostate over time, and these are once-a-day pills that could take 6 to 9 months before they show effectiveness. And they are a good medicine as well. Those medicines also, some studies have shown that they might help prevent prostate cancer, so they have another benefit. There are also some treatment options or surgical procedures which are done for the prostate. The gold standard, which has been around for 60 years, is called a TURP, or transurethral resection of the prostate. Some people will call it a ream job or a roto-rooter job, or most of us have an uncle or grandpa that got their prostate reamed out, so to speak. That's what they're referring to. It's an operation that's done in the operating room under anesthetic, so people don't feel any discomfort. We pass a camera through the urethra here into the inside of the prostate, and an electrical cautery wire loop is used to scrape out the tissue of the prostate. Patients wake up with a catheter or a rubber tube exiting the penis that drains their bladder. We watch them in the hospital overnight to make sure that no blood clots are going to be forming in their urine, which could block their catheter, and we can usually let them go home the next day. Some people stay a couple of nights in the hospital with us. There's another procedure that's more popular. It's a newer technology with a similar technique. It's called transurethral laser enucleation of the prostate.